most of you know me, I'm Cheryl Young. I'm the palliative care clinical nurse specialist at Hospice. I'm 20 years here. I know I don't look it. 20 years here in July. So I first came to the island about 24 years ago. Worked in the acute ward 8 with Dr. Nate Hawkins. He doesn't really remember me. I was insignificant really to him then. Still am. So there I really loved the end of life patients. So I decided in July of '97 to apply to the bank at Hospice. So there I worked a couple of months, and then a permanent post came up in September. So I started there, and I actually did my first day on nights with Diane Barber, who's still here, although she's now switched to days. Then I had my daughter Amber in 2000, Millennium Baby, and in November of the year I returned to work after having a few months off, and I became Hospice at Home coordinator, so I changed my roles a bit. And I worked there for about a year and a half, and that gave me an opportunity to work within the community. Before I'd only worked in the acute setting and the IPU. So I worked with some staff nurses and some healthcare assistants at the Hospice at Home. And then really I missed, I have to admit, the acute side of palliative care, if you can say that, and came back to the inpatient unit about 18 months later. And then an opportunity came up for a practice development role in the hospital with Violet Platt, who was the first hospital palliative care nurse specialist. And then she went to Australia. I don't know if that had anything to do with me, hope not. She went, and Christine Bloomer took over her role. And then it worked out great for me because a second posting came up at the hospital. So I worked alongside Christine and the oncology team at Nobles, visiting patients in the hospital. We were sort of, the way the CNS team worked at that time was we had a palliative care hospital team and a community team. And then under Christine's influence really, we looked at the way the team worked, and after a bit of research and audit and looking at patients, we decided maybe the best way to look after our patients effectively really and for them was to amalgamate the hospital and community together, so we would follow our patients through from hospital to home if they came back into hospital. So we then became one team, and we all worked community and hospital based. And then a great opportunity came for myself through the Tri-Island working, where we worked alongside Jersey and Guernsey and Gibraltar. And they were looking to further their palliative care service in Gibraltar. Initially it was only going to be a couple of months, and I thought, well, I can't really move myself and my family to Gibraltar, but then it came that it was going to be at least an 18-month placement. So after long discussion, and really those that know me, I've always had a bit of an itchy feet. So I took up the opportunity, and myself and my husband and daughter, we all moved to Gibraltar for 18 months, which was very hard work, I have to admit, but great work, working with the district nurses, working with the hospital team. We have it very lucky here. We're very lucky on the Isle of Man, not just in hospice, but I think the services we have for an 80,000 population. Sometimes I think we forget how lucky we are. In Gibraltar they didn't have social workers, they didn't have a hospice, they didn't have hospice at home nurses. So we're very, very lucky. People had to go to England for treatment, into Spain, so very lucky. But after 18 months, really the decision was, should I stay on or should I come back? And I think really with Amber about to go to secondary school, I think probably it was the time to come home really to the island. So I did that and I came back to the CNS team. And at that time, the lovely Liverpool Care Pathway that you'll love, well, some of you know about, some of you don't, we were implementing that into the community. So I took up the coordinator for that. And then, very sadly, I feel anyway, it was dissolved because of media and a lot. So we had to look at a different way of bringing end-of-life care and promoting it. And so I became end-of-life coordinator and looking at different policies and different ways to refer people to coordinate their care. So I did that for a while, and then during that, different roles, I had the opportunity of joining the NICE committee in London, and I helped present the guidelines for care of the dying, which was published just over a year ago. So that was a great, I think not prestige, but for the Isle of Man really, that they were involved, not myself personally, but the Isle of Man were involved with something so political really, and so, well, it was NHS guidance, so that is out there. During the time, looking back now, I did A-levels, but I didn't really study for them. I got into nursing. And I think I would say to anybody now, if they get the opportunity, do degree while you're young. I mean, I'm still quite young. It was hard work. I did my diploma, I did my degree, I've done my master's, all while working full time, and it's hard. I think the opportunities now from 25 years ago when I first came into nursing is much greater professionally. And then I moved again, went into education, which I loved at the time, but I have to admit after about a year I did miss the clinical side. I'm probably a nurse through and through, where I liked the hands-on part, visiting patients. So an opportunity came because Mary, one of our most long-term palliative care clinical nurse specialists, she left and retired, and Jackie also retired, and a post came up. So I've come back really full circle, probably 10 years back to the palliative care nurse team. I love my job, I have to admit. There's very few days, although Christine might say otherwise, there's very few days that I wake up and I think, oh, I really have to go to work today. I can't see myself doing anything else but nursing. But I think you have to want to be a nurse. I don't think it's a job that you can just think, oh, one day I'm going to be a nurse and I'm going to care. I think it's something that you have to have compassion for and want to be the best at. So, thank you very much.